Having stayed in hospital without noticing any improvement and with very basic care, the couple resigned to coming back home. Her husband says his wife was tossed around every time they inquired about her treatment.
Kati nga nnina wanebbwa nga nnina ne wano ne mbagamba munnongoose ebiwundu ndaba bigenda mu maaso.
I had 2 wounds and asked them to operate on me again, but they said there are no specialists until February.
Ne batusindikako eri mukazi olite eri wansi ne batusindika ne batugoba nti haa eyo nedda.
They kept tossing us around to the casualty ward, then ward 2B, and we got confused.
This woman had an ectopic pregnancy, a condition in which a fertilized egg settles and grows in any location other than the inner lining of the uterus. Her pregnancy developed in the abdomen around the intestines, and 2 months after the operation, she developed complications with fecal matter discharging through the opening on the abdomen. But despite the condition, the couple claims they did not receive appropriate care and found no need to stay in the hospital.
I wash a lot to keep her clean.
They are called runaway cases. When you run away from the hospital cannot trace you. Otherwise, she should have received post-operation treatment. And this is continuous because this already was an abnormal situation. The pregnancy was not in the uterus. That is a precarious medical condition. So, if she had properly been discharged, I am very sure that the doctors would have continued to look after her, and by now she would be recapitulating.
The couple was hit by tragedy twice: the death of their baby at 5 weeks and the backyard inferno in which all her husband's property was destroyed. An ectopic pregnancy occurs in about 1 in 50 pregnancies.
We have those who have cases of fistula. All those conditions are worked on here at Mulago. Our gyno emergency is full of such cases. So this one really, it could have been a complicated case, but not so above the experience and skills of our super specialized.
There have been great advances in the early diagnosis and treatment of ectopic pregnancy, and mortality from this condition has decreased dramatically. Irene Namyalo, NTV.